The Challenged Parenthood Initiative (CPI) has confirmed that out of the 2,788,335 population of Kogi State, only 646,623 people have been vaccinated against the COVID-19 pandemic as of November 2022. The Executive Director CPI, Eunice Abimbola Agbogun, gave the details when she briefed journalists on enhancing demand creation and uptake of the COVID-19 vaccine project in the state, executed by CPI in collaboration with Center for Information Technology and Development. She expressed worries that only 23% target eligible population have so far been vaccinated. Our reporter tells us more.
Eunice Agbogun said data from Kogi State Primary Health Care Development Agency shows that the total number of people vaccinated as of November 2021 was over 125,833, noting that the low figure was due to myths and misconceptions that surrounded the vaccine and its effects.
Some had been badly brainwashed through social media that taking the vaccine could result in infertility, maiming, and magnetic body sites of vaccination, which deter them from yielding themselves to getting vaccinated. Some were expectant of financial inducement before they would accept the vaccination due to false information that the government attached such an incentive to the administration of the vaccine. Other beliefs again, adamant individuals. Death comes by any means. With or without the vaccine, one would die. Hence, vaccine have no shield or effect against any individual's health status.
The executive director explained that the achieved target is too low when compared to the national average of 65%. Hence, the state has a lot to do to measure up.
The total number of population vaccinated when the project commenced, when we started this project in 2021, was 125,833. And by the end of November 2022, the figure has increased to 646,623. So we can see some very significant progress there. As of Monday, December 19, 2022, the NCDC website reports that 266,381 infections and 3,155 deaths have been reported in 36 states and the Federal Capital Territory. On Friday, December 16, 2022, the National Primary Health Care Development Agency reported that 59,867,077 eligible persons have been fully vaccinated, while 12,403,486 of the eligible persons are partially vaccinated. The proportion of fully vaccinated represents over 54% of the target population.
Agbogun appealed to Kogi State government to provide mobility and proper supervision for self-delivering of vaccine to the people living in remote areas to increase the vaccination rate in hard-to-reach communities in the state.
Security challenge. Most local governments suffered internal security challenges ranging from banditry, kidnapping, and intercommunal clashes, e.g. Basa and Omala local government. Hard-to-reach communities, lack of mobility to transport staff and their equipment, and for proper supervision and mobilization at the grassroots due to the difficult terrain, access roads and river. Wrong data entry at the local government level. Non-adherence to the approved data template by the National Primary Healthcare Development Agency at the local government level due to inadequate basic knowledge of data entry, and no availability of mobile device that meets the specification for the job.
The CPI, who also solicited prompt remuneration for health workers involved in COVID-19 vaccine campaign, urged stakeholders to continue to encourage adherence to health and hygienic guidelines from relevant agencies.
The issue of non-payment of stipends due to healthcare providers involved in COVID-19 Scale 3 campaign is impeding coverage in many local governments. It is good to note that the Presidential Steering Committee on COVID-19 on the 12th of December 2022 has approved the relaxation of all COVID-19 safety measures and travel advisories, including the lifting of protocols for travelers, the compulsory use of face masks in public spaces, and restriction on mass gathering. NCDC nevertheless urged Nigeria to get vaccinated, complete their vaccination dose, and take other essential preventive actions.
She charged for the need to sustain the current CPI and SIDAT-sponsored public education program, airing in the indigenous languages, including other incentives for a better delivery. The CPI chief executive encouraged health workers and volunteers to actively participate in the exercise. Faith Abdulgafar reporting for MSC TV.